Good day, everyone. My name is Cornelius Dodoo. I'm a pharmacist and a senior lecturer with University of Health and Allied Sciences. I'm also the country lead for our health partnership. So in terms of overview, our health partnership involves University College London Hospitals, University of Health and Allied Sciences, and Ho Chi Minh Hospital. With our first CwPAMS project, we were looking at enhancing hospital pharmacist roles to support the delivery of antimicrobial stewardship programs in Ho Chi Minh Hospital. This was an educational intervention project where we had a series of capacity building sessions on antimicrobial stewardship, infection prevention and control, and then we had some basic sign language skills because we believe that clients with hearing impairments should also get the right message when it comes to how to take their antimicrobials. We then determined the antimicrobial prescribing patterns in Ho Chi Minh Hospital using the Global Point Prevalence Survey tool, and then helped establish an antimicrobial stewardship committee in the hospital. Our second project was looking at enhancing the capacities of healthcare providers in the practice of antimicrobial stewardship programs, looking at the role of local data and safe medicine practices. With this project, we helped develop an antibiogram for Ho Chi Minh Hospital, and then went on to determine the antimicrobial disposal practices of healthcare workers in the hospital. Then we had a series of leadership training sessions for members of the antimicrobial stewardship committee, and finally developed an AMS policy document and a 2-year action plan to guide our work when it comes to antimicrobial stewardship and resistance. Regarding our experiences when it comes to fostering behavioral change in our work, some of the interventions we have implemented to this point includes incorporating behavioral change as a key component in our training. We also established an antimicrobial stewardship committee in the hospital to lead the course when it comes to stewardship in the hospital. Then we further equipped members of the committee with some leadership training skills to help them perform their duties better. We developed an action plan for the hospital, as I indicated, to guide our activities. Then we had training on how to conduct point prevalence survey for members of the AMS committee and other key staff in the hospital. Regarding the changes we have observed in Ho Chi Minh Hospital to this point, we currently have an AMS policy document developed, and the AMS committee is leading on its implementation. At the moment, point prevalence surveys are conducted annually in the hospital. This helps the hospital keep track of what they are doing when it comes to antimicrobial use. And then there's periodic engagement of staff and dissemination of antimicrobial stewardship and antimicrobial resistance findings to all key stakeholders in the hospital. Some of the challenges we have faced to this point include sustaining motivation and encouraging the use of the AMS policy. We've struggled to secure local funding to support AMS activities in the hospital. When it comes to lessons learned, one key thing we have observed is that no cadre of healthcare staff can address AMR alone. You need a multidisciplinary approach to address issues of AMR. And then it's always important to periodically engage key stakeholders on the subject. With our current work, we are looking at establishing Ho Chi Minh Hospital as a center of excellence for antimicrobial stewardship in the Volta region. So we are adopting the hub and spoke model, whereby our hub will be Ho Chi Minh Hospital, and then we would make use of the experience and expertise we have built over time in healthcare workers in Ho Chi Minh Hospital to help train other healthcare workers in the secondary healthcare facilities. So with this, we intend to develop an AMS champion training scheme, which would obviously include behavioral change as a key component. And the plan is for this to be used for continuous education and also for orientation when it comes to new staff who have joined the facilities. Another key component of our work is launching a medicine take-back campaign within the whole municipality. So this we are doing in collaboration with the Food and Drugs Authority in the region. This would involve behavioral change at the community level, So with this as well, the plan is to continuously create awareness via local radio stations and social media campaigns on the campaign we intend to launch. So in a nutshell, that is what we have done and what we will be doing. Thank you for your attention.